Those personal home videos of her dad launched award-winning journalist Lisa Ling to investigate what's being called the new silent killer in America's prescription pill crisis. There's a drug that might be in your medicine cabinet right now. Benzodiazepines, also known as benzos, are used to treat anxiety and insomnia and a bunch of other things, and their popularity has increased tenfold, 10 times in the last several years. Lisa Ling joins us now with the shocking side effects of long-term use of these sedating drugs and what no one is telling you about quitting them. Thank you for being here.
Thanks, Dr. Oz.
Your documentary is spectacular, and much of it's based around a personal story with your father. And before I get to a lot of other stuff, how is he doing now?
My dad's doing great, and that's why it's still disturbing to me, because there was a period in 2016, he went in for a heart condition. He has a heart condition, but he also had trouble sleeping. And so the doctors prescribed Klonopin, which is a benzodiazepine. And he, as you just saw, just became completely uncontrollable. His body, he couldn't stop shaking and was crying profusely. And so I started looking into this, and we decided to do an episode for my show about benzodiazepines.
So one of the reasons I'm so passionate about this topic, and the same thing that I saw in opiates is happening here, is that we in the profession don't realize how much of a problem this is. I actually didn't really appreciate its significance till my good friend Jordan Peterson, who's a world-class psychologist, acknowledged recently that he was going to rehab. And I thought, my goodness, if it's that slippery a slope that someone who's a trained expert, world-class psychologist is falling into the pit, what about the rest of us?
It's scary, Dr. Oz.
Well, benzos have been around for a long time. They're prescription drugs, right? And they're psychoactive. And so they treat a bunch of conditions. They come in boxes and packages like this, right? You can use it for insomnia and anxiety, seizure treatments, etc., right? All the reasons you see there are reasons: muscle spasms, restless leg. I mean, a bunch of simple things and a bunch of more complicated things. Right? They come in big bottles, so you can take a lot of them, because if you've got insomnia, well, you might need them a bit, right? They're known as Xanax, Valium, Klonopin, other names as well. You've heard those. And then, of course, they have this package insert, which I'm going to come back to in a second, right? Because this package insert does mention a lot of things that I had never paid attention to. Now, you've struggled with your own dad, but you've also talked to people who've had a problem with benzos. What's generally going on in their lives? How long were they on before they got addicted? How did they get hooked in the first place?
Well, that's the thing. The people that we talked to, some had been on for a shorter duration, some had been on for a long time, and their doctors just kept prescribing the drug.
I mean, I wouldn't go as my first-line drug, but because it works, doctors get comfortable prescribing it.
Well, and that's the thing. They are highly addictive. Your body and your brain feel like they need more and more, and so one has to wonder why doctors continue to prescribe them. I'm not sure if they know that these should only be prescribed for very short periods of time.
Well, if they're safe, we would prescribe them longer, and what's the big deal? But you found that maybe they're not as safe as we've been led to believe. What are the side effects?
So the side effects, I mean, there are many. Increased anxiety, sleeplessness, becoming really erratic and shaking, hallucinations, and suicidal thoughts. And that's the thing. Very often we may hear that a medication incites suicidal thoughts, but that's very, very different from what I heard from people I talked to. I mean, they describe these suicidal ideations that were so forceful in pushing them to believe that this is the only option because their body is so out of control and in such excruciating pain. And these are not things that doctors are telling their patients.
It's interesting. Everything you mentioned is in this package insert.
It is. And I'm married to a physician, and I can't tell you how many times I've gotten medication and I just start taking it right away and totally disregarding the literature. It's there. But you know, as someone in the episode said, when you are in a situation where you feel like you need something, you trust that your doctor has your best interest at hand, right? If your doctor were to say there are some very alarming potential side effects that could include these things, I mean, I think those are things that doctors should mention in the room when prescribing these benzodiazepines.
So Lisa's been on the front lines with the very people who are struggling the most with some of these side effects. Up next, the truth about benzos and suicidal thoughts, what you need to know about taking these types of drugs and what no one seems to be telling you about quitting them. We're back investigating the shocking side effects caused by long-term use of sedating drugs like benzos. And by side effects and time, we're talking about a couple weeks and suicidal thoughts. Jonathan, who you saw in the clip, ended up taking his life after struggling to quit benzos. His mother, Debbie, joins us now via Zoom. And Debbie, I'm so sorry for your loss. Take me back to when your son, Jonathan, was first prescribed benzos. What was he taking them for?
Well, Jonathan had decided to switch shifts at work. And Jonathan decided to go to the 5 at night till 3 in the morning shift. When he got home at 4 in the morning, he couldn't fall asleep. So we went to our family doctor and he gave him a sleeping pill. Well, within a month and a half, he was only taking it on his 4 days he worked. And before we knew it, at 2 months, he started getting anxiety and stuff, and his body was now craving it. So now Jonathan ended up taking a benzo every night to sleep for 7 months.
So, Debbie, you say he didn't want to be on the medication. He was trying to stop. What happened when he first tried to quit?
Well, what happened was Jonathan, after the 7 months, he had said, the medicine's not working anymore. I'm not sleeping. So Jonathan just stopped it. We didn't know that you could not just stop a benzo. Within 2 to 3 days, we're at his doctor. His doctor is now to the point of, oh, you're having anxiety. So what is his doctor? His doctor prescribes him another benzo and says, oh, you're just having anxiety. And a week later, we're back in there. His depression is so high. He says, oh, well, here, you need an antidepressant now. You know, oh, because you're having this. They never realized he was in benzo withdrawals. When you come off a benzo, you never stop cold turkey off a benzo. Never.
What do you think your son would have wanted all of us to know about these drugs, these benzos?
Jonathan would tell you, my life was turned into a battle with my brain to stay alive. The drug is horrifying. What it does to you is, you can't imagine the darkest places that this drug will send you into. Jonathan, he would tell you, don't be afraid to question your doctor. Ask your doctor if he knows how to get you off. Ask your doctor how long you're supposed to be on a benzo. Question the doctor.
Debbie, I thank you so much. I know how painful it is to review this and revisit it, but you're going to change a lot of lives. God bless you, and I hope the healing comes fast. Let me bring back in journalist Lisa Ling, who's been investigating benzos. She's talked to researchers and doctors about these drugs. What is the latest on how these drugs change the brain? And I just noticed something from that talk. He was off the drugs for a couple days.
Well, see, that's the thing about benzos. That's the thing. Benzos can leave your system entirely, in some cases, before you even start to experience withdrawal. So you go into your doctor with all these symptoms, and he or she is treating you for those symptoms and not treating you for the benzo withdrawal.
Let's go over this. This is what Lisa's saying is happening to the brain. So anxiety, other abnormal symptoms happen when the brain's receptors become overwhelmed. Come help me tell this story, because you've been through this. So you've got these receptors, they're firing off. Benzos slow down the flow of chemicals. See these little red dots? So you can actually feel relaxed again. This is the most common thing we're all struggling with. It's normal. But if you take benzos for an extended period of time, right, that happiness dissolves. Your brain becomes too reliant on the drug. And now you may need more benzos to save the exact same problem, or else you feel like this. You've become dependent. Now, benzos are safest when taken for no more than, I would say, 2, 3, 4 weeks, in that range, right? Not months. And here's why quitting benzos cold turkey is so dangerous. Your brain no longer gets the signal to slow down or relax. The natural system's not working. So it goes into a state of crisis. You get a flood of signals. The neurons fire like crazy, even when the drug's out of your system. right? To stop this, your brain wants benzos. And without this, you get withdrawal symptoms, right? Your mild anxiety, as we just saw, Jonathan, turns into full-blown panic attacks, hallucinations, tremors, suicidal thoughts. And sometimes you act on those thoughts. So Lisa, you reached out to drug companies.
Yeah.
And you wanted to know if these side effects are something that, you know, that they're seeing, but most importantly, what their advice is for actually getting off the benzos.
So we reached out to the makers of Klonopin, Ativan, Xanax, and Valium, and they said that the benefits outweigh the risks. And if the medication is taken according to manufacturers' guidelines, that is the way they should be prescribed. And if they're consumed that way, you shouldn't have a problem.
But are we prescribing it that way? As a doctor, I'll speak to this. I don't think I would have prescribed it correctly before seeing the show. And this is not how we should be prescribing something that clearly has lethal side effects. So up next, the red flags that everyone needs to know about regarding benzos. They're going to be important and life-saving. Stay with us.
Everybody pretty much said the same thing, that he couldn't sing from note one. He was trying really hard. He walked off stage a few times. He was clearly struggling. He forgot words to songs. It was not a Soundgarden show. It was not a Chris Cornell show.
That was musician Chris Cornell's widow, Vicky, talking about his suicide. Now, she told us that he was using benzos at the time. We're back with journalist Lisa Ling, investigating what you need to know about benzos right now. And you actually learned about the risks of benzos from Vicky.
From Vicky Cornell. I was talking to her and she was telling me about all the things that Chris was experiencing while he was on benzos and going through withdrawal. And I was just so astounded. I had never heard anything like that. And so I started looking into it, and that's why we're here today.
Yeah, I'm worried that it's the next opiate epidemic. So we want to intervene before it becomes a full-blown epidemic. Everyone, take your phone out right now. Take a moment to stop, snap, and share some red flags of benzos, and share it with people you know who are taking these meds. Because I've asked the audience here, put your hands up if you know someone who's been on benzos. I mean, literally, the entire audience put their hands up.
Yeah.
I mean, it's difficult to live in America and not know someone who's on benzos, or maybe yourself. So, red flags are increased tolerance. You find yourself needing to take more in order to stay at the same results. Drastic mood changes, right? More extreme highs, more extreme lows. Memory or focus issues, right? So for folks who want to quit benzos,
yeah, I mean,
what do you
the
think?
most important thing to keep in mind if you're on a benzo, it's what Debbie Wagner said, do not quit cold turkey. If you do want to stop taking benzos, you have to seek out a therapist who specializes in benzodiazepines. The worst thing that you can do, especially if you've been on benzos for a long time, is stop cold turkey.
Yeah. All right, it's a big challenge doing your own, so don't try it. You can catch season 6 of Lisa's wonderful series, This Is Life, Sundays on CNN. Be sure to tune in this Sunday to see her wonderful investigation into benzos. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.